I know right away people talk about guns and the discussion that has occurred nationally about guns, but this isn't just about guns. It's about mental health, that we need to have better mental health within our communities. How do we deal with individuals who are distressed? What do we do as a community to try to stop this? So I think there's a host of responses that we as Americans can say, let's stop this, let's do something about this.
The chief medical officer of MedStar Washington Hospital Center calling on all of us to start the discussion on mental health issues in the wake of yesterday's shooting massacre. Many people are echoing the doctor's words as we learn more about Aaron Alexis's history with mental health issues. Fox 5's Laura Evans is covering that part of the story for us and joins us now. Hi, Laura.
Well, hi, Will. You know, the concern over mental health is a common denominator in many of the recent shootings we've seen. We've seen that in the Virginia Tech massacre, the theater shooting in Aurora, Colorado, the Sandy Hook school killings, and now the Navy Yard. Aaron Alexis, we know, was mentally troubled. We also know he was getting help, but none of the proper connections indicating that he was a danger to the public were made.
Aaron Alexis was a good-natured guy, according to some friends, but he was also emotionally troubled. Undergoing mental health treatment from Veterans Affairs as recently as last month, officials say the man who shot and killed 12 people at the Navy Yard on Monday had been hearing voices in his head and was dealing with paranoia and a sleep disorder. According to people who knew him, Alexis also complained about the Navy and about being a victim of discrimination. Cindy Crane, clinical psychotherapist, says it is possible this could be a classic case of workplace violence.
People get their identity from the work that they do, and then when something happens that's negative, they take it out on the workplace as representing all things that are wrong and bad in their lives. And they need retribution.
But what stands out to Crane is his prior issues with gun violence. Alexis had run-ins with police over shootings in 2004 and 2010. She says there are clearly holes in the country's mental health system.
But in combination with escalating behavior, unusual or threatening behavior, a flag should go up and a warning should have been sent somewhere.
Alexis served nearly 4 years as a full-time reservist. Then in 2011, bouts of insubordination, disorderly conduct, and being absent from work without permission prompted the Navy to grant him an early but honorable discharge. Since the Navy didn't declare him mentally unfit, Alexis maintained his security clearance to get onto the Navy Yard. Friends also say Alexis was in a building near the Twin Towers on 9/11 and that he suffered from post-traumatic stress disorder after that experience.
I don't believe that PTSD in itself causes somebody to behave the way he did. There had to be other mitigating factors.
This is a prescription for disaster, and someone who said that he suffered with PTSD. There will be people who want to focus on the gun. We need to focus on the man and the mental health care system, which is shattered, can't do its job, and needs to be rebuilt.
FBI behavioral analysis personnel are on the investigation, still trying to figure out a motive. Dr. Keith Abloh says getting proper treatment for mental health issues needs to be the focus.
There were opportunities here. We shouldn't divorce, as it is currently divorced, the court system entirely from the mental health care system.
Cindy Crane says early intervention when it comes to mental health issues is key. It's important to err on the side of caution if you see a behavior that raises a red flag for you. And she says that we need to learn to treat mental health issues as seriously as physical health issues.
Yeah, I think we're learning time and time again it's about connecting the dots, and we have to talk about mental health issues.
Yeah, our mental health system is broken, and something needs to be done.
It's a real eye-opener.
Yep.
All right, Laura, thank you.
Yeah.